Amanda with Straightsmile Solutions, straightsmilesolutions.com, and kind of like the previous video I just made about early itty bitty expanders in 2 to 5s and how there's a little bit of a gray area and how you kind of have to be working with an MD, and check out the AAPD's policy on that. I actually put it on my website for the littles. If you go to Straightsmile Solutions, I kind of buried it, but go to get started and then help with RPE, and then it's in there. Help with pediatric expansion cases, but it's there. If you can't find it, let me know, I'll send it to you. But today I want to talk a little bit more about getting started with expansion cases without having someone looking over your shoulder in a negative way. So what I'm getting at is, if you don't want to be working with an MD, then don't do the itty bitty cases and don't do the really old people cases. Do the normal cases. Do your regular palatal expansion cases that orthodontists do, right? Standard stuff. What's standard stuff that we're allowed to do as dentists on our own? Palatal expansion for orthodontic reasons. When you start going into the sleep and the airway only and not doing it for orthodontics, then you're doing it for medical reasons. I know it's so stupid. It's semantics, it's words. It's like, wait, huh? You know, like, this doesn't make any sense. But that is the way the standard of care is now. So you can look at the AAPD's position in my website. I told you where to find that. And then in terms of the ADA, you know, they say, can a dentist do palatal expanders? And sure, orthodontists treat orthodontic jaw problems with orthodontic devices. Again, orthodontics. We are doing an expander because we need to do palatal expansion, because the patient has a vaulted palate and does not have position to put their tongue, you know, where it needs to go, which is causing, etc. There's got to be a reason orthodontically to do the expansion. That's what I'm getting at. So when you start doing it only for airway, only for sleep, is when you have to have the doctor involved. I'll help you with the orthodontic expansion. First molars need to be in, all 4 of them. That's my only rule, okay? That's it. Happy to help you. Check out what we have on our resources. You can do an a la carte case. You can do a premium case. You can do a concierge case. You can do an hourly case. We have so many different options. We will help you as long as the first molars are in. If you're trying to do it earlier than that, you got to find someone else. We'll help you finish the case. If you're trying to do it in an adult, heck no, I'm not touching that. You can take your own liability someplace else. And keep in mind, I'm looking at the ADA right now, and they are actually posting, they're asking the public and the profession to report concerns with palatal expanders in adults. Now, this article is dated April 3rd, 2023. The ADA is encouraging public and dental professionals to follow the FDA's prompt reporting adverse effects on adult palatal expanders, okay? So be careful is all I'm gonna tell you. I ain't touching that stuff. Learn something from what I'm doing. Yes, you can do palatal expansion in adults. Yes, there's a ton of risks. Yes, you better have a reason to do it and be working with a physician. All right, thanks so much.